For ReachMD, this is Audio Abstracts. The following is brought to you by Prova Education.
Patients with cystic fibrosis suffer from chronic progressive pulmonary disease, driven by cycles of airway infection and inflammation. Chronic cystic fibrosis lung disease is characterized by bacterial and fungal colonizations that change upon disease progression and patient aging. With intensified antibiotic therapy and longer survival, patients with cystic fibrosis are colonized with a more complex pattern of bacterial and fungi. However, the clinical relevance of these emerging pathogens for lung function remains poorly defined. In a study published in the Journal of Cystic Fibrosis, lead author Dr. Andreas Hector and colleagues aimed to assess the association of bacterial and fungal colonization patterns with lung function in adolescent patients with cystic fibrosis. Microbial colonization patterns and lung function parameters were assessed in 770 adolescent European cystic fibrosis patients in a retrospective study with a median follow-up time of 10 years. Colonization with Pseudomonas aeruginosa and MRSA were most strongly associated with loss of lung function, while surprisingly, colonization with Haemophilus influenzae was associated with preserved lung function. Aspergillus fumigatus was the only species that was associated with an increased risk of infection with Pseudomonas aeruginosa. Microbial interaction analysis revealed 3 distinct microbial clusters within the longitudinal course of cystic fibrosis lung disease. The results from this retrospective cystic fibrosis study confirm and extend previous studies demonstrating that infections with Pseudomonas aeruginosa, or MRSA, are strongly associated with loss of lung function in cystic fibrosis. Collectively, this study identified potentially protective and harmful microbial colonization patterns in adolescent cystic fibrosis patients. Further studies in different patient cohorts are required to evaluate these microbial patterns and to assess their clinical relevance.
This has been a presentation of Audio Abstracts. The proceeding was brought to you by Prova Education. For more information and for reference links of this article, visit reachmd.com/audioabstracts.